increase their rate. They might have somebody who has an intermittent block. And when the heart is beating normally, the pacemakers don't fire. But if there's a pause, the pacemaker will fire. They have variable rates, they have very long-lived batteries, and they can do very well over many, many years and saved a lot of patients' lives and returned them to normal activity. When the patient, going back to this diagram, didn't die of a heart attack from an injury here, they could have become what is called a cardiac cripple, unable to do anything except for the advent of the pacemakers. So the conduction system is a very delicate, very finely balanced system that has a lot to do with the physiology and the timing. Now, what can happen in another aspect of this electrical system is some patients who, for example, might have valve stenosis, a tight valve. What's going to happen to an organ pushing against a tight valve? It might dilate. This valve might get big and thin-walled like an overblown balloon. Then what happens is the distance that the conduction has to go is further than normal. Not very far, but still further. And that can slow down and throw off the timing. This is another area, atrial dilatation, where the timing may be thrown off and the pacemaker may help. Let me go through now and show you the phases of the cardiac cycle, and then talk to you a little bit about how this is affected by all the timing and what's happening in the rest of the heart. The first phase, and I'm not going to get into specific pressures, but we're just going to talk about high and low pressure rather than numbers. We call the first phase the phase of relaxation. Nothing is pumping. It's a split second, literally a split second, where the atria on both sides and the ventricles on both sides are in complete relaxation. So we actually have atrial and ventricular diastole. Blood comes in now, coming back from the body or back from the lungs, body on this side, lungs on this side, come back into the atria, and then will pour into the ventricle through the mitral and the tricuspid valves by gravity, by suction, and passively fill the ventricles. At the end of that portion of the cycle, the atria give its final little squeeze to push that last 30% into the ventricles and fill them up. And as we said, that's the part that's kind of optional, just a matter of efficiency. There's a law now that comes into place called Starling's Law, sometimes called Frank-Starling's Law, to give somebody else credit, which tells us that muscular contraction and its power is very dependent upon stretching. So if you have muscle that's at a normal length, just resting, it can contract with certain power. If you stretch it a little bit, it's like stretching a rubber band. It can contract with more power. And just like a rubber band, if you stretch it too much, it'll overstretch and lose power again. There's a place on that curve where you get to the maximum power in Starling's Law, and that's just what the ventricles do. Looking back again now, so this ventricle and this ventricle like that extra little squirt of 30% of the blood to overstretch these muscles and allow a more powerful, efficient ejection of blood. That's Starling's Law, and that brings us back to the bundle of His and the slowing down of the conduction to allow a pause so the atria can contract before the ventricles do. In the next phase of ventricular filling and cardiac cycle, the valves are open at this point because blood is still flowing through. We have atrial contraction, which in this case is called atrial systole, but we usually don't talk about it. And then we are approaching the point where the valves are still open. These valves, the aortic and the pulmonic valves, are now opening because of contraction, and ventricular systole starts. Both sides, both together, ventricles contract, and both these valves open to allow the blood to go out the pulmonic and aortic valves. This is the very beginning of the third stage. What happens to these valves? Well, there's clearly going to be back pressure here and here as the ventricle contracts, because this valve is open, the pulmonic, the aortic valve is opened, but hemodynamics and pressure changes are going to close this valve, allowing no reflux, no regurgitation back into the atria. In patients who have regurgitation, for example, women I mentioned and some men with mitral insufficiency, a prolapsed mitral valve, this little leaflet right here might flop back. Or do you remember the chordae tendineae, the little tendons that held it? One of those might rupture and allow it to flop back. That would just decrease the efficiency of the whole ejection. So now you have the ejection phase. Blood is going out into the circulation, feeding the brain and the legs and the arms and all the organs. And blood is also going out here to the lungs for reoxygenation and for getting rid of waste materials. We'll talk more about that in the respiratory side of things. When we have completion of this cycle, it all starts again. The ventricle's relaxed, blood comes back into the atria, and the whole cycle begins. And we have pressures changing constantly. High pressure in the two ventricles with low pressure in the atria. When the atria are contracting, the ventricles are relaxing, and they're trying to get the maximum filling. Now here we have a very interesting problem going on, and that has to do with the coronary arteries and what's called diastole. If you remember, in our last slide, we had two little arteries coming off the right and left side of the aorta to fill and feed the myocardium. These were called the coronary arteries. Think about what's happening. At this point, the muscle, this very strong muscle of the ventricle, and some of the strong muscles on the right side of the heart as well, are in tight constriction. They're pumping as hard as they can. The vessels that are trying to give them blood flow are being squeezed shut. The coronary vessels, which are feeding this very hungry myocardium, can't get any blood in. So during systole, when the whole body is getting blood, and all the blood is pumping out to all the organs that need it, heart isn't getting any. The only time the blood can get, the only time the heart can get its blood to its muscle is during diastole, during the rest phase. When the myocardium relaxes,